Hello everyone. I would like to talk changing mindset about ear care and hearing loss. I'm Nyilo Purnami from Department of Otorhinolaryngology, Head and Neck Surgery, Faculty of Medicine, Universitas Erlangga, Dr. Sutomo Hospital, Surabaya, Indonesia. As we know, the hearing loss often being referred as an invisible disability, not just because of the lack of visible symptoms, but because it has long been stigmatized in communities and ignored by policymakers, as stated by WHO Director General Tedros Adhanom Ghebreyesus. World Hearing Day 2024 will focus on overcoming the challenge posed by societal misperception and stigmatizing mindsets through awareness raising and information sharing targeted at the public and healthcare providers. Overall, the hearing loss globally, over 80% of ear and hearing care needs remain unmet, and nearly 60% of hearing loss is due to avoidable causes that can be prevented through implementation of public health measures. And stigmatizing mindsets are key factors that limit efforts for preventing and addressing the hearing loss. And important is changing mindsets related to ear and hearing care is crucial to improving access and mitigating the cost of unaddressed the hearing loss. This important thing is changing the thinking. How we accept the hearing loss. Hearing loss can be a very difficult problem because experiencing loss is produce grief reaction. So usually followed by stages of grief like denial, anger, bargaining, depression, and finally become acceptance. It is important to remember that the negative feelings associated with loss, including the loss of hearing, will fade over time. And important, wearing the hearing aids. People will notice the effects of hearing loss more than the hearing aids itself. Failure to use aids can be perceived as stubbornness. Wearing aids demonstrating motivation to communicate better. How about assertiveness? Studies show that the people least affected by their hearing loss are those who most assertive in conversation. Assertiveness means awareness and expression of the individual rights. About the stress management, stress should be managed, of course. Trying to find the stress management techniques that suit to the patient. Learning to relax, control stress, and takes regular practice. And how about the changing mindset? Try to make the best of any conditions, managing stress, assertiveness, improving the ability to communicate, mastering the will substantially reduce the effects of the hearing loss. And how others can help. One is important to reduce the background noise, such the noise is kind of poison, can be disturb the communication. And mind that hearing aids are less effective in group situation. Try to get closer to the person, ideally directly opposite. Ensure that nothing is obscuring the speaker's face and better face and lip reading. Speak at a moderate level, not too slow and not too fast. Clearly, distinctly, and don't shout. Rather than constantly repeating, try to rephrasing the words. And WHO already launched the poster for educational materials, changing mindsets about ear care. Like earwax, the myth is needs to be cleaned. In reality, the ears are self-cleaning. Ear pain, the myth is treated with a home remedy, but reality see a health professional. Cotton bud, the myth is good for ears, but reality not for ears. Discharge from ears, the myth is small inconvenience, but reality an urgent problem. As the hearing loss majority can be prevented, so the prevention is important. Thank you very much for listening from the World Hearing Day 2024. Let's make ear and hearing care a reality for all.